I couldn't be more excited to be joined by Adele Gulfo, who is president of Pfizer Primary Care in the United States.
Hi, Eve. I'm so excited to be here, and congratulations to our Pfizer Woman of the Year, Frida Lewis Hall, and our rising star, Karen Massey.
Now, Adele has a long and varied history of volunteering and supporting the HBA, so we are absolutely fortunate to have you joining us here today. Okay, first is an industry question. What do you see as a leader in healthcare as the burning issues that, as a leader, you're aware of and that you think our rising leaders need to be aware of over the coming years?
That's a big question.
Big question.
I'll start at a macro perspective in that, we have an aging population and patients are living longer with chronic diseases that are treatable, right? And they're actually wanting to live longer, healthier lives, so they're demanding more from the medicines that they take. What that means for us as an industry, from a biopharmaceutical perspective, is that the payers and the governments are demanding more from us as it relates to the value that we demonstrate and deliver for the medicines that we bring to market. So that brings all sorts of complexity around more challenging development programs, greater risk, and more cost. And we're tackling that at Pfizer on a number of different fronts, and we can go into that.
Now, when it comes to women play multiple roles in the healthcare industry. I mean, They work in the healthcare industry, but they're also major decision makers. Do you see women as leaders bringing a unique perspective to some of the driving issues that we're facing in healthcare?
Oh, of course. That's such a good point, is that women are the largest consumers of healthcare, as we know, not only for themselves, but for their families. And it's so important that they have a decision-making seat at the table as we're making these important healthcare decisions. We need women to have not only important roles in healthcare, but what I like to say is important P&L roles, so that they have a seat at the table and that they are showing that they can deliver value to real important parts of the business. And bringing that diverse perspective, that's what women do. We're going to bring a unique perspective to the table. So we need great women leaders, as we need great male leaders. We need diversity of leadership in healthcare in order to solve some of the problems that we're facing.
Adele, one more quick question, although the list could be very long, but can you give me the top one or two examples that you found of the HBA working in tandem with your organization to help women rise up the leadership opportunities?
I would say there's probably two things. One is the networking opportunity and the ability to just be out there and meet many new different people and organizations. And the other is to be able to demonstrate your value in a very safe, comfortable, risk-free environment. I have a long history, as Eve mentioned, with the HBA, and I can remember in my early career, I started in the sciences, steeped in medical affairs and clinical development. And when I got into the marketing organizations, I didn't want to be naive or ask lots of stupid questions to my colleagues, but I felt very comfortable with so many of the fabulous women leaders, some out there today, Shelley Kaplan, Lynn Voss, Nancy Larson, Nancy Lurker, who I can remember going to with some of the questions and issues that I had, and really helped me to grow and stretch as a leader.
Well, thank you so much for joining us, and I hope you really enjoyed today's program.
I will.
Thank you so much.